COVID-19, scientists keep watch on new version of Omicron. Scientists and health officials around the world are keeping their eyes on a descendant of the Omicron variant that has been found in at least 40 countries. This version of the coronavirus, which scientists call BA.2, is widely considered stealthier than the original version of Omicron, because particular genetic traits make it somewhat harder to detect. Some scientists worry it could also be more contagious. But they say there's a lot they still don't know about it, including whether it evades vaccines better or causes more severe disease.
Where has it spread? Since mid-November, more than 36 countries have uploaded nearly 15,000 genetic sequences of BA.2 to GISID, a global platform for sharing coronavirus data. As of Tuesday morning, 96 of those sequenced cases came from the U.S. Thus far, we haven't seen it start to gain ground in the U.S., said Dr. Wesley Long, a pathologist at Houston Methodist in Texas, which has identified 3 cases of BA.2. The mutant appears much more common in Asia and Europe. In Denmark, it made up 45% of all COVID-19 cases in mid-January, up from 20% 2 weeks earlier, according to Statens Serum Institute, which falls under the Danish Ministry of Health. What should you do to protect yourself? Doctors advise the same precautions they have all along: get vaccinated and follow public health guidance about wearing masks, avoiding crowds, and staying home when you're sick. The vaccines are still providing good defense against severe disease, hospitalization and death, Long said, even if you have had COVID-19 before. You have had a natural infection, the protection from the vaccine is still stronger, longer lasting and actually does well for people who've been previously infected. The latest version is another reminder that the pandemic has not ended. We all wish that it was over, Long said, but until we get the world vaccinated, we're going to be at risk of having new variants emerge.